I consider myself lucky to be standing here sharing my breast cancer story. Things could have got much worse if I did not advocate for myself. In short, 3 doctors missed my breast cancer, which turned out to be at stage 3 by the time it was diagnosed. I wish to tell you my story so that you can help yourself get the right person to help you. Toward the end of the video, I will show you how my breast surgeon was able to diagnose my cancer when 3 other doctors missed it, so that this may be a point which you can ask your doctor about to ensure that you remain in good health. I'm Lei, and my breast cancer journey started a few years ago when I felt a hardening in my left breast for a few weeks. I am not one to take my symptoms lightly, and so I went to see a doctor. Dr. N, a family doctor, sent me to a radiology facility where an ultrasound examination of the breasts was performed for me. Since I was 33 years old at that time, initial evaluation did not involve a mammogram. This was my first ultrasound report. The first doctor who missed my cancer was the radiologist Dr. L. Based on his final conclusion that there was no sonographic lesion detected in either breast, Dr. N, who was the first family doctor I saw for my symptoms, felt that there was no need to proceed with any further investigation. In retrospect, I would say that at this point, these 2 doctors had missed the opportunity to make a diagnosis. After the initial assessment by Dr. L and Dr. N, my mind was not totally at rest with this result, so about 2 months later, I went to see another doctor, Dr. D, about my symptoms. Dr. D also sent me for another ultrasound examination of the breasts, and this was the report. As you see, once again, it was reported that there were no discrete lesions demonstrated within either breast in the ultrasound study, unchanged from the previous examination 2 months before. This time, the radiologist, Dr. E, did mention that there was an area of induration noted in the lower inner quadrant of my left breast, and a comment was made to manage my signs and symptoms on clinical grounds. Dr. E was the 3rd doctor not to have identified my cancer. But the second family physician I saw, Dr. D, did not dismiss my symptoms as the other doctors had and referred me to a specialist. The breast surgeon I was referred to recorded these findings after she examined me. She found that I had a 4-centimeter palpable lump between the 6 to 7 o'clock position in my left breast, as well as a 3-centimeter area of induration at the 1 to 2 o'clock position of the left breast. The specialist arranged for a biopsy to be performed for my left breast lump. The type of biopsy was termed as a core biopsy of the breast. Pathology of the tissue cores taken from the breast lump was reported to be invasive duct carcinoma. This is the medical term for breast cancer, and treatment was then commenced. So can I urge women to persist if you are uncomfortable about your symptoms, even when initial tests do not reveal any abnormality? Seek a second opinion if needed. While my circumstances, admittedly, are rare, my persistence definitely helped me secure a diagnosis and much-needed treatment before my cancer progressed further. You could certainly help yourself get early treatment by being persistent and seeking a second opinion if you feel your health issue has not been fully evaluated. I am not alone in this. There are other patients, like this person, who share their story on social media who have also encountered the same situation, where the first doctors they saw did not persist in evaluating their condition. Gigi was 36 when diagnosed with stage 2 breast cancer. I was 33 years old when diagnosed with stage 3 breast cancer. I asked the breast surgeon who diagnosed my cancer why it was that such a large cancer was not detected on 2 ultrasound scans. My breast surgeon gave me a very brief introduction to how ultrasound images of the breast are interpreted. This picture shows an area of normal breast tissue. When there is an abnormality, it may look like this. Or this, where there is a clear demarcation between a very dark area and a lighter area. In my case, it was tricky to interpret or read the images produced by my lump without adequate information from the physical examination. For me, there was a need to directly correlate my symptoms with the ultrasound finding and make a combined assessment. This image, which was taken from the area of interest in my second ultrasound study, did not appear to have a clear light-dark demarcation, so it was not interpreted as a lesion or area of abnormality. What my surgeon did was to carefully review the ultrasound images taken from where both she and I felt the lump, and compare it to the images obtained from an area in my breast where both of us did not feel any lump. Although the light-dark demarcation was not clear at the 6 o'clock position of my left breast, the appearance of the imaging was different from the area at the 4 o'clock position of my left breast, where I did not feel any lump. It was this difference that led her to make a recommendation for a biopsy. I am so glad that my cancer was diagnosed and treatment was instituted soon after. I am not sure what the consequences might have been if the diagnosis was further delayed. So, my advice to my fellow breast cancer patients is to advocate for yourself. If you are not comfortable with your symptoms and one doctor's opinion, seek a second and possibly a third opinion to ensure that your doubts are clarified and your questions answered. I hope the information which I have shared as part of my cancer journey has been helpful to you. If so, please like, share, comment, and subscribe so that others may have access to it. For more detailed information, you may wish to visit the Just Medicine website and submit a query. I look forward to sharing with you more of breast cancer surgery vignettes to help you on your journey to thriving in life and survivorship. I wish you the very best of health. Take care.